Hello, everybody. Thank you, Mark, for being
Andrew.
here. So much to talk to you about, and
Why?
perhaps
What's
more
going
than
on?
anybody else. Excuse me?
What's going on?
Nothing. So, the election happened.
Yep,
Your entire business is about to change.
it is. Again.
Tell us, if you could, I imagine there had to have been some kind of meeting that happened yesterday morning at Aetna, whether with the board or with management. What happened during that meeting?
Well, so at 3:30 in the morning, I'm trying to calm down my daughter, who is beside herself. She just became a top executive at Univision. She moved from Gawker to Univision, and she's doing digital, and she was more excited about the fact that she got to vote for the first female president of the United States. And so throughout the night, she's just looking at me going, this can't be true, this can't be true. And she said, well, what do you think? How does this affect your deal? Always the journalist trying to figure out what we're going to do. And I said to her, if you were to look at our game board of all the possible outcomes that could have happened in the election, this one wasn't even on the sheet. And every time somebody would bring up and say, well, what if the Republicans sweep? I said, get out of the room. It's not even. So we started with a fresh piece of paper yesterday. We had no idea how to approach it.
And so you start with a fresh piece of paper and you start writing down what? Hell, we can do it with you here this morning.
No, believe you me, my brain hurts today. Who would he talk to? Who knows anything about what's going to happen next? What are the potential ways this could be approached? Who's going to take what position on which issue? I mean, we literally had to build out what we would have spent months doing had we thought it was even remotely possible. We had to scramble in a day.
Okay, so walk us through the permutations. Let's say that Donald Trump, when you get off the stage, magically were to call you.
Yep.
And say, Mark, I need you to come over to Trump Tower.
Yep.
I think actually he's at the White House today seeing Obama.
he is,
But maybe
yep.
tomorrow, come visit with me on Fifth Avenue and tell me, I told the public I was going to repeal Obamacare.
Right.
What am I going to replace it with?
So I think that's the big question. So I think there will be a repeal first, and I think the repeal will be at a minimum in name, because what's going to happen over the next year is we have people signed up, so we have to honor that commitment through 2017. We'll have to act quickly to get something in place for 18. So I think things like guaranteed issue, no pre-existing conditions. I think things like 26-year-olds on their parents' policy. I think the expansion of Medicaid are all very important programs that we need to continue. So how do those get passed going forward? And then we have this population that really currently uses the exchange, which are people between 45 and 65 who have chronic illness and can't afford their own insurance outside the exchange and need to be subsidized. So I think on the first populations, it's easy to make that happen. We can keep those program changes in place. And as a matter of fact, they weren't part of the ACA in a lot of ways anyway. Medicaid expansion was. And I think the opportunities on Medicaid expansion probably are a block grant to states that says, you manage it, here's your money.
And so what does this mean to your business, though? When this happened, a lot of stocks actually went through the roof yesterday. Yours went down.
No, it actually went up. We're up $14 a share over the last 2 days.
I thought you originally went down.
We did, but it went.
You zoomed back up. My apologies.
We zoomed back up because it's over the deal, right? So the whole DOJ, DOJ's blocking our deal with Humana. They're suing us, and so everybody's now running the arbitrage on the deal.
And so what happens?
What happens with the DOJ?
Under this circumstance, does this make sense?
I don't know what happens. I don't know what the DOJ does.
No. I'm saying to your entire business strategy.
Okay, yep.
Over the past year, you've built out a whole new business strategy.
The strategy is the same. Nothing changes. I mean, 81% of the American public hate their health insurance. They hate the healthcare system. We have too many uninsured. It's not affordable, even for people making six figures. So it still has to be fixed. We still need to insure everybody. The approaches will be different from a policy standpoint and a funding standpoint, but we still need to have a product that's affordable, more personalized, simpler to use, that people can buy like they buy everything else today.
Is there any conceivable way that under Trump, there will still be, although those 22 million Americans who are part of this
Right.
will still be insured at the end of the day.
Realize more than half of that are people on Medicaid expansion. So we can solve that problem with Medicaid expansion. We have about 2.5 million who are students and other people who had, are on our parent plans. So you've got 12.5 or 13.5 million people who we can continue fairly simply, just by changing the way we fund it. It's the population that are currently in the exchanges, which are largely struggling in a big way. There really are people that are too young for Medicare, but need the support of a Medicare-like program. So Secretary Clinton's program around extending Medicare for more, down to people that met a means test to age 50, 55, is a reasonably good solution because the Medicare Advantage program works. You can support people in that program. We have high quality ratings, over 90% quality ratings from people who use it, compared to 81% negative in commercial insurance. So if we go after that program and say, how do we make Medicare available for people who can't afford it otherwise, who don't have employer insurance and need a subsidy, we can make that work.
Based on the things that he has said, though,
Right.
do you think that's possible?
Yes.
You do?
Yes. I don't think you can take 17 million people, or how many number of people you think it is. We think it's 17 to 20 million people. You can't put them out on the street without insurance.
So let me ask you this, though. Trump has said he favors keeping one key aspect of all this, which is effectively outlawing the old practices of refusing to cover people with pre-existing medical conditions.
That's guaranteed issue, right?
That's the guarantee issue.
Yeah.
How do you make that work economically if the exchange doesn't exist? And not to suggest, by the way, the exchange currently as devised is working either, which we should talk about in a moment.
Right. It's all about, so the insurance model used to be this model where we get as many people as we can in the boat with an average risk pool, and then we'd underwrite it at a cost structure that would allow us to grow only a little bit every year so that we didn't take on bad risk. That's the old insurance model. That's the model that the ACA was built on, a flawed model. What we have found out in the Medicare population, particularly Medicare Advantage, 75-year-olds with 3 chronic comorbidities, if you embrace them and you bolt a nurse to them every day, just to make sure they're taking their meds, they're getting to the doctor, they're socialized, they're active, you can actually reduce those costs. And the reason that the industry started taking care of 75-year-olds with 3 chronic comorbidities is the government said, we'll pay you for taking that risk. So if we have an underwriting model that says, if the person's sick, we'll pay you more to cover that, therefore everybody in the system, including the providers we partner with, have an incentive to drive the cost down.
Who would you like to see be brought into the Trump administration to deal with this particular issue?
Somebody who knows what they're doing. Number one, somebody who knows it well, and somebody who can work with Congress and the administration, to get Congress and the administration to work together.
Is there somebody in the Trump orbit that you know of that you think would be capable of that?
There are a lot of names being thrown around. I think the bigger issue is not who is the secretary, but how the structure underneath the secretary works. Because you have folks in Washington who have been there for a long, long time who watch administrations come and go. And they preserve the current order of things as much as they can. So you need somebody in the secretary position that can get the people that actually stay excited about what they need to do to change and do it differently than the road they've been on before.
If Donald Trump called you to do this, would you do it?
I'd have to have a conversation with my board of directors because we have a whole succession thing we need to do and a big deal sitting out there we have to finish. So
Does the deal still make sense?
it does.
Even with all of this?
I think what you will see out of the administration as well is that you'll see a larger program around Medicare Advantage with premium support. Congressman Ryan's, Speaker Ryan's program, where you have premium support, and I can say with a lot of conviction and data that Medicare Advantage in the end analysis is a lot cheaper and provides better care. And so if we're looking for a way to make entitlement work around the promises we've made to seniors, we need to make that program more robust.
Help us understand this. What is going to happen to everybody's premium in this room?
This year?
Do it for next year.
So if you're on the exchange, 25% looks like a pretty good number this year. It's going to be bigger next year, unless we fix it.
And if you have a Cadillac plan and you're employed?
Well, I think all the things like Cadillac plan, premium tax, all that sort of stuff is going to go away, right? we're going to see a repeal of the law. And the way they're going to repeal it, because they don't have 60 senators on the Republican side, is you're going to have to do it in reconciliation as part of the budget, so it needs to be related to the budget. So that's going to be about the funding inside the budget.
Right.
Right?
You've spent a lot of time in Washington, and I just want to...
36 hours a month. That's all I give my team.
What do you mean 36 hours a month?
I only give them 36 hours a month in Washington. Otherwise, you have to be reoriented when you come back to the real world.
Let me ask you specifically...
Donald's going to find that out pretty soon, by the way.
Let me ask you about this Humana deal and what was going on in Washington. There was there was a FOIA request that put some letters into the public. You know where I'm going with this.
Yeah.
Where it appeared as if you were threatening the Obama administration over your support of Obamacare.
Right.
In the letter, it said, if the DOJ sues to enjoin the transaction, the Humana transaction, we will immediately take action to reduce our 2017 exchange footprint. You're now cutting participation to only 4 states. Right. Politico's headline was, sue us and we'll scale back on Obamacare.
Right. No good deed goes unpunished. That was a letter in response to a very specific set of 6 questions as part of a civil investigation demand by the Department of Justice regarding our deal. It was one of many demands we had for data and many letters that we sent them. And because they asked us specifically about how we would think about withdrawing from the exchanges if the deal got blocked, if our capital got compromised, we answered them about the exchanges. They didn't ask us about the other businesses that would be impacted or how we would manage our capital. That letter, we sent a copy to Secretary Burwell to make sure she didn't get blindsided by the DOJ. That letter was released in 2.5 hours after a FOIA request by the Huffington Post. Now, during this most recent campaign, you heard the Clinton team argue about the fact that it took, in 8 months was the fastest FOIA response in the history of the federal government. No, ours was in 2.5 hours. And we don't have any evidence of a FOIA request. So the reason that is that there was an attempt to discredit our organization, which had been very complimentary and supportive of the program, but all along very concerned about very specific parts of the deal.
The larger question, though, was that support genuine or was that support attached to the transaction?
No, it was genuine. We were the largest provider of exchange population the very first year back in 2014, 17 markets. We were the largest carrier. The deal wasn't even a glimmer in anybody's eye then.
Let me ask you a reputational question, which is, you said that everybody hates the health insurers.
Yep.
And I could even go broader and say that there's a general negative feeling about the healthcare industry.
Totally, sure, right.
And yet there are amazing drugs that are changing people's lives and doctors who are doing extraordinary things. How do you think about turning the tables?
It's about the experience.
Is that something that you think can happen?
It can, and it's about the experience. So I'm a Detroit boy, grew up in Detroit, worked on the assembly line of Ford Motor Company. So I'll use a car analogy since you're not a healthcare audience. How many people go to General Motors Acceptance Corporation to buy a car? Nobody. Insurance companies are the GMAC of healthcare. How many people go to General Motors to buy a car? Nobody. GM makes cars. People go to a dealership and they talk about their ambitions for transportation. I have 4 motorcycles and a pickup truck in my garage. They're clean all the time. They're charged. My better half has a 14-year-old Subaru with 1 headlight. God washes it when it rains, and it goes to the shop when it doesn't run. We have very different ambitions about our transportation. What we do in healthcare is we say to people, here's a card, and when you need a warranty, come and see us and we'll fix you. It's the wrong way around. We should be talking about people's ambitions for health. And so when you talk to people about what their health care means to them, they talk about what their health prevents them from doing. And if we want to engage individuals, we have to engage them in a different way. So if you were a diabetic with neuropathy and you couldn't feel your feet, we said, if we could fix that for you, and if you'd work with us, you could run 5 miles. If you never ran in your whole life, you'd say, who cares? So you have to have this conversation with people that say, what are your ambitions for your health? What's in the way of your health, and how can we create a project with you? And the financing, which in most other industries is the last question you deal with, is something that will make the most affordable to you in the end. That needs to be the dialogue.
You hired Gary Loveman to work at your company.
Yep, Gary,
Gary from Caesars.
yes,
The casino company.
yes,
Means you're the house.
yes.
How is the way he thinks about the casino business applicable to the insurance business?
It's gap analysis. So, Gary's all about machine learning and data, and it's gap analysis. So he knows people like me, when they go into the casino, should spend X dollars every time they walk in the casino. And he's incredibly disappointed when I show up because I don't gamble the way somebody with my personal income should gamble. And so his project is how do I solve what Bertolini spends when he comes in versus what he could spend given his demographic? Flip that now for healthcare and say, if we have an individual who's a diabetic with neuropathy, which is, by the way, is going to be pandemic in our country here before long if we don't get in front of it. If we have an individual that has that, what does the best person with that set of demographics and disease look like? And how can we solve that gap by making an investment in them? How much should we be willing to spend to bring them along? And so we just flip the paradigm on cost versus revenue, and we flip the paradigm on focusing on what we can do to engage the individual. Because at Caesars, what they'll do is they'll gig you with, okay, here's some Celine Dion tickets. Here's some Elton John tickets. Here's free dinner. Here's a bigger room, all to get you to spend more money. And so what do we do with, and which is what we've done with seniors. Let's put a ramp in front of your house. Let's get you to the senior center by Uber. Let's get, let's socialize you. Do you like play bridge? We know of a bridge game in town with people your age. Let's get you there because it's better when that happens versus somebody showing up in an ER and spending 10 grand.
Final question for me, and then we'll open it up. You recently, back in January, raised your minimum wage to $16.
Right.
What has the impact of that been?
So we raised the minimum wage $16 an hour. We wiped out healthcare costs, cost sharing for people under 400% of the federal poverty level. And we just put in place a program where we'll repay up to $10,000 worth of student debt for each of our employees. And all of that is about what Ronald Reagan said back in the 80s. You need more walking around money in your pocket. And when people's personal disposable income is just chipped away by their boss, by their employer, by the environment, by regulation, what happens is they have less walking around money. And if we can put more in their pocket so that they worry less about what they're doing at work every day, and they take better care of our customers, they have lower stress. People at the highest stress levels in our company, we did a study, had $2,500 more of healthcare costs every year at the highest levels of stress. So if we can reduce that stress level, that's a worthwhile investment for us. So all in, it'll cost us $30 million a year to do it. Our employee engagement scores are up 800 basis points. People are happy about their work. And we have higher retention after a year. So it's all good. It's a worthwhile investment.
Okay, let's open it up to questions. While we're getting the mics down, we have Sylvia Burwell here this afternoon.
Oh, great. I like Sylvia a lot. She's a really...
What should we ask her?
Where's she going to work next?
With that, I see a number of hands. Let's get to them right there, sir.
You made a great point about the exchanges being a disaster, but I really don't want to ask about that. I want to ask about the 85% of the people that had employer-covered insurance before the ACA. And we ran some numbers. We've always believed in providing that to our employees. Over the last 8 years, our premiums have compounded at an 8% annual rate, and we had to put in a deductible. So our employees feel the bite, and we feel the bite. Why did that happen? Why were things so much better for most people before, and what can be done to change that?
Part of it is the tax structure that was put on all of your employee programs. So the government requires us to pay a tax on every member that we cover, every dollar of insured business we have, so that they can fund the Affordable Care Act. That will go away, number one. But let me make sure you all understand, and this is the really important part, this idea that health insurance companies with 3.5% or 4.5% margins are, running the rates up to make everybody wealthy. It's not. It's the underlying healthcare costs. And when you look at underlying healthcare costs, 10% of premature death is associated with clinical care. 20% is your social environment. 30% is your genetic code, and 40% is lifestyle. So 60% of premature death is driven by your zip code, not your genetic code. In areas of Baltimore, people have 20 years less life expectancy than somebody in the next zip code. So our underinvestment in social is driving healthcare, and what we need to do is rebalance that and get in front of social determinants. So it's cheaper for us, and we've learned this in the Medicare population. Put a ramp in front of the house, get somebody to the senior center, make sure they have food in the refrigerator. So we now go into the homes to make sure that the social determinants are there because it's cheaper than waiting for somebody to show up. So we've got to get out at the overutilization of the system. We've got to keep people at home. We've got to understand social determinants, and we can drive down the healthcare costs because that's where your premiums are going to be stable. 85% of your premium goes to healthcare costs.
Okay, let's sneak one final question. I saw a handful of hands that had gone up earlier. You have a mic.
Hi, Tom Schmidt. I appreciated your comments about the assembly line, and I guess I'll take that a step further. When my father in the 70s would buy a truck for our farm, he would go to the Chevy dealer, and then he'd go across the street to the Ford dealership, and then he'd go back to the Chevy dealership, and it was a price competition. In this business, we tend not to have price competition or freedom of choice, or we get the bill months after we've gotten the service. What role do you see in the future of competition for this service at all levels, playing in the change of the way we're treated and we consume?
So what we've got to avoid is conspicuous production of capacity, which is what we have now. And so it's all about a revenue. The hospitals work on a revenue model. Doctors work on a cash basis, and pharmaceutical companies, device manufacturers, and insurance companies work on a margin basis. So everybody's on a different economic model, so the system doesn't work. What your choice should be is your venue of care, not that there's another hospital across the street or another doctor across the street. And what we should be doing in the future is bringing your care to your home and doing as much of it there versus making you go out into the world, into the medical industrial complex where it's far more expensive. And so our whole view is let's reorient the whole system to where we bring as much to you in a gig economy with friends, families, and neighbors, seeing friends, families, and neighbors in the home. And through technology and high tech and high touch, we can bring that to the home. And then let's let the rest of the system be only as needed and an exception. And if people end up in a hospital, we failed. So you shouldn't have to shop for a hospital. We should keep you out of the hospital. It needs to be the new model going forward.
Mark Bertolini, thank you.
Andrew,
Could not have been more timely. Appreciate it very, very much. Thank you.